Hi, I'm Dr. Horton here at MDH Management. I have one of my patients here, Melanie, and she's going to undergo a treatment, a combination treatment that I call the IPL Fractora combination light and tight. So the first component, the IPL, addresses the most superficial abnormalities of the skin, including hyperpigmentation and little broken capillaries. And when I look at Melanie's skin, she does have some sun exposure, hyperpigmentation across her temples, her forehead, and the IPL is going to help mop up that hyperpigmentation and help to rejuvenate the skin. So that's going to address the most superficial aspects of the epidermis. Then to get a rejuvenation of the deeper levels of the skin, we're going to combine it with Fractora. Now, Fractora is a fractional radio frequency device, and it is part of this machine that you see in the background, the in-mode platform. So Fractora uses radio frequency energy that are delivered through fine pins. This is actually a minimally ablative procedure that does cause some small pinpoint bleeding. And so we want to get good topical anesthesia, and then I also follow that up with some infiltrative lidocaine to make the procedure more comfortable. So we're going to infiltrate the skin of Melanie's face and get some anesthesia, and then we'll come back and show you the procedure actually being done, the Fractora procedure, as part of the combination light and tight treatment here at MDH Management. So Melanie's all numbed up here, and we're ready to proceed with the first step, the IPL treatment, using the Lumeca IPL. Now, you may be familiar with IPLs, and there are a lot of different brands on the market, but there are only a few that stand out for their ability to be able to address hyperpigmentation in 2 or 3 sessions. And the Lumeca IPL, part of the in-mode platform that I use, is one of those 3 market leaders in IPL. The IPL, as I said, it attacks the brown pigments that lead to, that are from sun damage, that lead to a brawny, muddy complexion. And so she's been numbed up here for the second procedure, the Fractora, and so she'll not feel anything when we do the IPL treatments, and we'll be back in a moment. So we've treated Melanie with the IPL treatment. She's a little bit red and pink, but I can see some darkening of the hyperpigmentation, the little brown spots across her forehead and temples. And that tells me that she's going to get a good response, that over the next several days, these little brown areas will darken further, and then they will fall off, like she had little bits of coffee on her face, and lead to a much more uniform complexion. So we're ready to do the Fractora now. The Fractora handpiece is, like I said, composed of small needles that actually penetrate into the skin to deliver that radio frequency energy below the skin. It does create a small wound in the skin, a microscopic area of injury, exactly like a laser produces, except Fractora has the additional benefit of putting deep energy, radio frequency energy, beyond the tip of the pin to the deeper tissues of the dermis and stimulates new collagen development. So that injury to the skin is what precipitates the skin tightening, improvements in texture, minimization of wrinkles, and overall a more youthful complexion. And Fractora can be done in a series of treatments. Many people find that one improves their skin, but they'd like to see additional improvements. So sometimes we do another Fractora treatment in 6 to 8 weeks, stacking the benefit, and the patients are happy with their results. So I'm going to go ahead and perform the procedure, and then we'll show you what the end result looks like. So stay tuned. So Melanie's completely done with her light and tight treatment here. She's had IPL and Fractora done at 2 different levels so that we can address the superficial, the medium, and the deep levels of the dermis, epidermis and dermis here, and really get a great outcome. So she's red. She says she feels like she has a sunburn. Is that right, Melanie? That'll last for a few hours. And in order to expedite healing, I have applied a silicone-based liquid dressing which acts like the scar band-aids that you might see advertised. It really helps people's wounds heal much more quickly so that their downtime is minimized to 2 to 3 days. So tomorrow Melanie will probably want to stay close to home, keep her face out of dirt, and be able to wash it with a very light cleanser, and then reapply the silicone-based dressing, and probably by 24 hours she'll feel like herself again, and within 48 hours she can apply makeup. And like I said, this has a downtime of 3 to 4 days, but that's varies by person. Some people are out shopping at the mall and the next day. So if you have any other information you'd like about the light and tight treatment here at MDH Management, give the office a call, 407-369-8994.